KwaZulu-Natal remains the country's COVID-19 epicenter with the highest number of active cases. Healthcare workers are seeing death on a catastrophic rate and are battling to deal with the load. We take you into a Durban private hospital for an exclusive behind-the-scenes look into their COVID-19 fight. Nabila Sheikh filed this report.
Like the rest of the country, healthcare workers at Durban's JMH City Hospital are struggling to catch their breath.
It's a packed COVID-19 ICU at this private hospital. And while doctors and nurses say they're glad to see a slight decrease in admissions over the last week, they're still under immense pressure.
The hospital has set up a special field unit to deal with the influx of patients.
We've seen a virulent strain of the virus that has ravaged our communities. It's created untold despair and death, a lot of it from patients and people's behavior. So as much as we are trying to do our best and help as many people as we can, we know we can't help everyone.
KwaZulu-Natal has had more COVID-19 related deaths over the last few days compared to the rest of the country.
We've had young patients come in, pass away on ventilators. We've had colleagues get sick. We've had staff that have worked for years, almost a decade, that have gotten COVID the second time and have passed on from getting the virus the second time. So the level of anxiety that it's created, it's just absolutely immense.
Doctors here fear a third and fourth wave if vaccines don't reach us soon. And being the last defense against the virus, they desperately need it.
Government has told us that this vaccine is going to be available to healthcare workers by the end of January. It's now 8 to 9 days before the end of January, and we haven't really heard about what or when we're going to get this. So there's been lots of talk about appreciation of healthcare workers. I think it's now left to government to show us that they really appreciate us by getting us this vaccine on time.
Nurses on the front line say they are struggling to cope.
We're seeing patients dying daily. The patients running out of oxygen, we have to commence oxygen. It's very stressful.
And constantly losing their own isn't making the fight any easier.
We are trying, we comfort each other. If we are feeling very tired, you go and rest for a while and come back. The work has to be done at the end of the day.
Healthcare workers here say there's no telling how things will play out, but they're begging South Africans not to let their guards down. Nabila Sheikh, Durban.